Well, all right, I think might as well get started here. Tim, you ready to kick us off?
Yeah.
Go ahead and share your screen. I'll get us going. Well, hello, everybody. Thank you for joining today for this session focused on public health. This is a continuation of a series of events that we've been holding focused on healthy communities. We got a quick agenda for you all, and if you go to the next slide. We're going to do a quick intro. I'm going to turn things over to Tim, who's co-hosting with me today, and give a quick overview of the sessions that we've held in the past. And then we'll jump right into the presentation by our four esteemed speakers. And we're going to try and reserve about 10 minutes for Q&A at the end. But feel free to drop questions in the chat, just so we can keep track of those. Next slide. For anyone who's not familiar, the Academy of Architecture for Health is a knowledge community within the AAH, and our goal is to provide networking and educational opportunities. Next. We also provide mentorship and networking, not just within our profession, but with other partner organizations focused on healthcare, such as Women in Healthcare, AMFP, KHEAD, etc. We wanted to host this session today to bring forth some educational content for you all, and some continuing education credit will be provided as well. Next up. This is our group. I'm not going to introduce everybody, but we wanted you all to know who we are as our AAH chapter here. My name is Jack Reed. I've been the chair this year, and Tim and I are co-hosting this session. If you guys ever have any questions or want to know who to reach out to, these are the folks that are on our leadership team, and I know many of them are here in the call. So with that, I'll turn things over to Tim, and we can go from there.
Thanks, Jack. I'm a healthcare architect with SLAM Collaborative, and welcome everyone to our continuation of our annual Academy of Architecture for Health event on community health. So there's a lot of great literature out there on community design, but the intent of our events here is to really move towards a framework for action and help us understand the relationships that get us beyond the vestibules of our hospital. We help design and to get us out into the communities of our health systems. And our presenters today are really going to help emphasize the importance of this holistic approach to health. I did want to touch on some of our previous sessions just to reinforce that working on these sort of cross-discipline relationships has been rewarding for various health systems in Colorado. For instance, in our previous session, we heard about how WellPower's partnered with CHAFA and city government to supply a variety of housing types for their patients, and their buildings have incorporated trauma-informed design and utilized creative programming to embrace their communities. Today, in our cross-disciplinary panel, we're addressing public health design and engagement strategies to integrate health equity principles into our design projects. We'll be learning about how to engage with communities effectively and to form partners with public health professionals and systems. I was fortunate enough to catch a presentation from Liz Youngwin and Bill Mahar that was put together a few years ago at a planning conference, and their presentation inspired me to reach out and learn more about their work. And Liz sort of saw our interests in public health and rounded out our panel with some other public health professionals, Kristen Ellis and Ynke. So with that, I will pass the presentation to Liz.
Hi, everyone. Thank you so much, Tim and Jack, for inviting us to talk about how public health is working with our partners in architecture as well as urban planning to really think through how to shape healthier built environments and places for people. I'm Liz Young-Winnie. I'm a built environment coordinator at the Colorado Department of Public Health and Environment. I have a background in urban planning and public health. And I have a tendency to jump between the two. Right now I'm working in public health. In the past, I've worked in development review as a town planner. You can go to the next. My presentation is really trying to help us all set the stage and the foundation for the other three presenters. So I wanted to go through a couple of definitions that I think are really helpful to understand some of the public health lingo, as well as the reasoning behind why we're interested as public health professionals to do some of this work. So up on the screen, I thought it would be a good starting point to just say, what is public health? And provide you a definition from one of our professional organizations, the American Public Health Association. Public health is really interested in promoting and protecting the health of people. A lot of people in recent years have had varying degrees of contact with public health through the pandemic, but there's so much more that public health professionals do beyond just vaccines. So I hope that our conversations today helps to enlighten you on some of those items. You can go to the next. One thing that we talk a lot about in public health that I think is, again, just kind of foundational language for why we're really thinking about and doing this work is something called health disparities. Health disparities are particular health differences that are closely linked with social, economic, or environmental disadvantage. They're often things that are historically linked with discrimination or exclusion. You can go to the next. And they also have a large interplay with health equity or health inequity, which you'll often see. So health equity is really the attainment of the highest level of health for all people, and it requires valuing everyone equally with focused effort to address avoidable inequalities, injustices, and the elimination of disparities. So that's kind of how those two things work together. You can go to the next. Like I said, I'm a built environment coordinator. In public health, we define built environment pretty broadly, and it's coincidentally similar to our public health definition. But thinking through the built environment is really those spaces and places where people grow up, where they live, work, learn, play, as well as go to school or have hobbies. And interface with institutions like church or their civic duties. So I have a question for the audience, and if you'd like to participate, I would encourage you to just drop things in the chat. I always think this is a really interesting thing for people to think about. It's just this question of what makes us healthy. This is a pie chart, so I'm curious what people think are like the biggest portions of the pie and the smallest portions of the pie. Obviously, there's more than one thing here. So if you, like I said, if you'd like to participate, just start dropping some stuff in the chat, which I don't actually know if I can see the chat with all my screens that are open. Thank you for some of the people that are throwing things in there. Diet, exercise, sleep, stress, social, emotional well-being, built environment, access to nature, activity, connection. Daily activities like walking versus driving, having a supportive network, all really great things. If you want to click to the next, we'll be able to see what the pie chart looks like. So the things that make us healthy are really broken up into a lot of the categories that people started throwing out there with social and economic factors, as well as our physical environment and how that's supportive for us to be able to have daily activity or opportunities for exercise. Also things like the access to and the quality of our care, like from our doctors or the kinds of networks and health systems that we have available, like have interactions with and available to us. And then our behaviors, which again, kind of plays into all of these things. You can go to the next. So the reason that these reasons behind what makes us healthy is really what we call this idea of the social determinants of health. And you can click through the next one. And this neighborhood and built environment piece is where my work is. And as you'll see from the different presenters, a lot of ways that we interact with our neighborhood and built environment and what that means for our housing, our transportation, our perceptions, and our reality of safety. The parks that we have access to, playgrounds, walkability, zip code, geography, and how all of that has an interplay with our health outcomes. So really looking into that chart of what makes us healthy and streamlining some of those into this particular category as the social determinants of health and the things that create the conditions in which we have health currently and in our past and in our future. You can move forward. So the reasoning that we work in this space is this framework that we use in public health called the health impact pyramid. And I'm going to kind of breeze through this. I think the thing that I really wanted to share with you is that when we're talking about systems level or policy level work or design work, in this case with healthcare institutions, or ways to think through what a building would look like or space or community would really look and feel like, we're matching up with this pyramid in a couple of different categories. The biggest one being the changing the context to make the individual's default decisions healthy. In some situations within the work that we're doing, when we're talking about policy, systems, and environment, we're also looking at those socioeconomic factors. And the reason that we're doing this work is really because it creates the greatest population impact by addressing those things, and it creates the lowest individual effort that one person needs to be able to have health. So it's a nice framework to kind of explain why do we focus on built environment within public health, and I think all of that kind of sets the stage for what our presenters are going to be talking about today, but also gives you a little bit of foundational knowledge and information about public health and the ways that we work in partnership with other collaborators. You can move forward to the next. This is just a really great graphic of all the ways that a healthy and equitable community really has an interplay with health. I like this graphic from Change Lab Solutions. It talks through what it looks like to have safe, stable, affordable housing and what that really means from a health and equity benefit. I'm not going to walk through the slide, but I think it's a really great resource if you're trying to understand how different elements of our community or the buildings that we're creating have an effect and an impact on people's everyday lives and therefore their health. Go forward. I did want to talk really quickly about the unit that I work in at the Colorado Department of Public Health and Environment. It's called the Healthy Communities Unit. We focus on several different activities and topic areas, all of which are on this screen. And again, we use that urban planning lens to really have an impact on the way that we're doing our work within public health. You can move forward. Some of the things that we do are really partner across sectors, just like presentations like this, helping people to build their capacity and their knowledge, as well as work together to make some policy and environmental changes through granting opportunities, as well as participating in plan development. You can move forward. And then also using health data, just like urban planners and architects and lots of other people that interface with the built environment, we also use a lot of different types of data within public health. And we also like to use GIS to say, this is where we're seeing these changes, or this is where we're having an impact. You move forward. And then working with local governments. This is a main portion of my role as a technical assistance provider at the Colorado Department of Public Health within this Healthy Communities unit, is to make sure that my partners across the state are really tuned into how this could look for them and supporting them through their efforts to have more meaningful spaces for their community, as well as safe and great spots to hang out. I can't remember the word. You can move forward. All right, that's it. Thanks so much. And I'm going to pass it off to Bill. I am also going to help a little bit with moderating. We've got a lot of stuff to cover and a lot of people to chat. And so I'm going to stop talking, but I might have to butt in and say, please move forward if we're getting a little long. So go ahead, Bill.
Thanks.
Great. Well, thank you, Liz. Liz is one of my favorite public health badasses and a dear friend of mine. So it's a pleasure to be here, everybody. My name is Bill Mahar. I'm a principal with Norris Design, and like I mentioned, it's such a pleasure to be here and to be part of this dialogue. And hopefully, we can all learn from each other. Can you go to the next slide? So here's a little bit about me. You can read, but I'm really passionate about the intersection of placemaking, health, and community ever since I started my career. And so this is always a fun and endearing topic to me. And this morning, I really want to share a few stories that I hope you may find inspiring and useful. And with that, next slide. So let's talk about, why is health important? We all think we all have different answers to that, but what I found along the way is health in the built environment, they're complicated topics. When you sit down, when you go to a public meeting, explaining it to a fellow allied profession engineer, they're like, whoa, okay, what does that mean? What I found through my years of working with the Centers of Disease Control and local government and consulting, it does not need to be complicated. I think when you boil it down to the personal level, when you're engaging with people, ask them, what does health mean to you? And then they start to realize, they start to peel the onion. Okay, it means my parents, my grandparents, do they have a safe place to live? Are they able to get out into their yard, walk around? It's really those simple things. But the point is, that is what helps people understand and identify the importance of health in our built environment and why we need to focus on that more. It matters. Like here in this slide, I have pictures of my new puppy. You got to have a golden retriever puppy in a slide, right? Her name is Bergen. My husband and I got her in January. Now she's 50 pounds. And a picture of my family, they matter to me. And a beautiful place is a picture I took in Oslo, Norway this spring. So when I think of health, it's how it connects and resonates with me to the larger community and how we can make a difference. Next slide. So before we get too far along, let's just take a step back. How did we get there? I think a lot of us understand this, but what was the problem? When you think back to overcrowding in American major cities in the late 19th and early 20th century, we had a reaction to that, which is typical. What is our solution? And post-World War II, we really focus on autocentric frameworks across our country, and segregated land use was as the solution to the ills of the 19th and early 20th century. And due to some of those solutions, now we're struggling with their ramifications and how we deal with that moving forward. So, it's an ever-changing topic, health, and how we recalibrate it and how we learn more as we move forward. So next slide. So this is one of my favorite slides for today. For all of us, and me included, I propose like a call of action. When you think back of all the things we've been through in the past 4 years with the pandemic, we've learned some great lessons, and I hope we don't forget about them in our industry. The benefits of parks and open spaces and how they protected us. The ongoing climate change issues and sustainability, and chronic disease is not going away. It keeps increasing incrementally over the time. And a new chronic issue that is facing health is loneliness and isolation. And that was happening before the pandemic, but the pandemic threw fire on that. And it has become a big issue. And I'll talk a little bit about that. And there's some also positive trends in land use, mixed use and walkability that have been around for a while, and they are gaining support more and more all the time. So when you think about these all collectively, this is our time. It's such an exciting time when we start thinking about placemaking, buildings, parks, streetscapes, whatever, all the things we do collectively. How can we leverage those to address these number of issues? Next slide. In this next set of slides, probably one of my most fulfilling and lessons in persevering early in my career, in my early 30s. was when I was in Fargo, North Dakota as an urban planner. I grew up in a small town in North Dakota, and it was about fostering community change and how to get a community to change. So in my early 30s, I was charged with developing a riverfront master plan. You just see there between downtown Fargo, North Dakota, and Moorhead, Minnesota. And through that, it was the catalyst that got me interested in walkability and how can we improve the community, the metro area of Fargo Moorhead, make it more walkable, make it more of a sense of place. It needed a little love back then. And so I started reaching out to people, didn't really know what I was doing, but I just did. One of my lessons learned on this slide is find your friends. And through this process of getting the word out, I was approached by some home ec teachers, retired and active, and they wanted a tour of the riverfront and they wanted to see the master plans before they implemented. And they became my best advocates for a few years. They would show up at community meetings, they would go to city council. So lesson learned, find your home ec teacher out there, okay? Next slide. And we didn't stop there when we were talking about galvanizing the community and fostering change. We reached out to bring attention to pedestrian safety and right-sizing streets, making them fit the community and the scale of the neighborhood. We reached out to teachers in a couple elementary schools, and in particular art teachers, and they worked with their elementary students to come up with, to study artists and then apply their art in crosswalks. And it wasn't just about getting them out and painting, but it was about getting attention to this, thinking of it strategically, of getting the youth involved, getting their parents involved, getting neighborhoods involved, what's going on here, and then getting the media. And eventually Public Works got the message. And you go back there now, they got roundabouts and bike lanes and all the things. So, all of these things collectively work. And one more case study on that. Next slide. We did a wider net. We wanted to come up with a walking campaign. It was called Walk This Way. And I did this for a few years. And we cast a wide net across the metro area. Got organizations to lead community walks around their campuses, if it was a hospital, Audubon Society, through wetlands, and what have you, the university. And what it did is it brought out over 1,000 people to involve themselves in walks, learn about the community, learn about the shortcomings of pedestrian and bicycling in those areas. It got people interested. It raised the needle. And so these were a few strategies that I employed back early in my career that I found really made a difference. And it was a lot of fun. Next slide. And from there, I want to talk a little bit about third places. I want to share a story about my discovery what third places. I think we all in our industry understand what third places are. Those places that are authentic, that you can go to relax, you can gather with friends, coffee shops, what have you comes to mind. But there's also connection to our new epidemic that I talked about of loneliness. And 3 out of 5 Americans are routinely lonely, and public health professionals are realizing that the loneliness epidemic that is rising is outpacing obesity, and it is correlating to smoking 15 cigarettes a day. People are very isolated now. We know that from the pandemic, from our online lives and things like that. So what can we do collectively as a profession to start addressing that and bringing people more together, providing those opportunities, mixed use streetscapes? And I have one that I'd like to share about myself. Next slide. And this one is my aha moment that personally hit me. Intellectually, I knew about third places, but my husband and I live in the Whittier neighborhood in Denver. And during the pandemic, we had nothing to do except stare at each other after a while, and once we blew through Netflix. So we got a garden at the Denver Urban Gardens plot, a block away. We were blown away. This is a picture of our garden. We're kind of proud of it this year. We actually weeded it. And what we learned was we got to know our neighbors in our neighborhood. We had been there for 4 years and we didn't really know them. And we learn from each other about growing food, sharing food. Next slide. And that idea of, common interests and social connection. And the garden had happy hours and potlucks once a month. The point is, this was our third place in our neighborhood, and we were blown away by all of the benefits of that, of learning how to garden better from the long-standing gardeners, and just getting knowing people, and people who were looking out for us, looking out for them. They would water our garden when we go on vacation. They knew where we lived. It felt good, and this is a perfect model in an established neighborhood of that third place. And next slide. And just a few more things before I wrapped up. I thought this is kind of innovative. Even Walmart is seeing the value of third places. Who knew? Walmart. They have some prototypes that are moving forward with in the I read this in the Wall Street Journal this spring in the Southeast, of creating smaller footprints, nicer designs, but creating third places, community plazas, parks, as part of their facilities. But what a great idea as we move forward for how could that be, taken and put in place in another application. So that was a good sign. And lastly, I want to talk about Ynke Farm Park. This is a project, a 60-acre park in Fargo, North Dakota, that I was fortunate to win this past late 2022 and finish it in 2023 through my old connections there. And the story here is, this is a 60-acre underutilized park. It had 17 separate stakeholder groups that wanted to do vastly different things. Some of them wanted to put a water slide park, a hotel, but the park was actually controlled by the National Park Service. And I didn't know that when we applied. It wasn't in the RFP, so talk about scope creep. But we worked through that with the National Park Service. And after working through many, many meetings with these stakeholders, we really boiled it down to, okay, what's in the park right now that's working? There wasn't a lot, but we realized there are existing walking trails. There's 300 community gardens that are owned by, utilized by new Americans. And there's a lot of art that's in the park, from kids doing chalk drawings on sidewalks, putting up birdhouses and painting them. These very kind of entrepreneurial, just ad hoc things that happened. And so next slide. And so to complete this park, we really boiled it down to these three general principles to help guide it. We didn't focus on a traditional park approach of, softball fields and athletic complexes, because we knew there were plenty nearby. And so it was the idea of, let's make this a third place for many people. Community recreation for older people, sidewalks that are level, they can walk around, education and arts for the local school kids and the artist community to come out and do sculptures and what have you, and expand on that community agriculture footprint and nature. There's a lot of existing old trees. Get people out there, curate that. It's that idea of speaking more to the softer senses of art and immersing yourself with nature and growing food and connecting with people. Next slide. And here's a couple renderings that show the manifestation of it. We have a large splash pad, that more active area in the middle, but we have a lot more quiet, more contemplative areas. And one more slide. And then this shows existing community gardens that we had moved from another part of the garden and put them into smaller plots with shade structures, as you see, pavilions, places to sell their food, to gather, get out of the sun, enjoy each other, and celebrate their production of growing food. Again, that idea of creating health through social connection, healthier food choices, bringing people together from different ways of life. And it's currently under construction. I'm just thrilled to see it move forward. And next slide. And so just to go back to the call of action, I firmly believe this is an exciting time, and I hope you agree with me, but this is really our time. All of these challenges we had with the pandemic, and then current what's going on in our world with regard to placemaking, as architects, landscape architects, public health professionals, there's so much to be done, but by leveraging all of those, looking at all of the trends and some of the challenges, how we can leverage those to start designing and planning our built environments to respond to those in a more empathetic and exciting way. So I'm really positive about the future and where we can go with that. And I appreciate you all being here today. Thank you.
Thanks so much, Bill. I think we're transitioning to our next speaker, is Kristen Ellis.
Hey, thank you so much for the introduction. My name is Kristen Ellis. I'm the workplace wellness strategist over at Denver Health. And on the next slide, I'll share a little bit more about myself before sharing some different case studies and ways that Denver Health has been involved in placemaking and integrating the built environment into how we take care of ourselves and our community through health and well-being. So like I said, I'm the workplace wellness strategist. I've been there for about 7 years. My background is in kinesiology and health sciences. And then I later earned a Master of Public Health and a Master of Urban and Regional Planning alongside Liz. That's how we know one another. So in my current role at Denver Health, I oversee all of the organization's employee well-being programs and initiatives for our roughly 8,000 team members. Our employee well-being initiatives take what we call a total worker health approach, meaning we don't just focus on the physical wellness of our employees. We're here to promote kind of that whole person, that total well-being approach, meaning that we offer programs and initiatives not only in physical well-being, but also in mental and emotional well-being, financial well-being, and also social well-being. And you can hit the next slide. So just a little bit about Denver Health. I know many of you likely are from the Denver metro area and might be a little bit familiar, but I thought I'd just take a moment to explain kind of who we are and what we do. So Denver Health is older than the city of Denver. We were founded as City Hospital back in 1860 to serve the healthcare needs of the rapidly developing city. And since then, we've grown to become a complete healthcare system, proudly serving the Denver community at every place in their life. So our kind of catchphrase or tagline is "For Life's Journey." And I think that really encapsulates what we do. We provide care and services to people at all points in their life and regardless of their ability to pay. So Denver Health is what we call a safety net institution, meaning we provide healthcare to folks regardless of their insurance status and regardless of their ability to pay. So we provide millions of dollars in uncompensated care each year. We see a huge proportion of the Denver population. So it's estimated that we care for 33% of the population in Denver each year. That also equates to 1 in 3 Denver area children. And we also care for special populations, right? So folks like uninsured, like I mentioned, refugee populations, folks who are experiencing homelessness or addiction. And hopefully this kind of shows you just how robust Denver Health is and kind of gives you a little glimpse into our mission and vision. And you can go ahead and hit the next slide and I'll share with you just a little bit more. So I mentioned we're a pretty robust system, but we are located just south of downtown near 6th and Bannock. We not only have a hospital center, hospital campus, but we also have various family health centers and pharmacies kind of strategically positioned around Denver. So, thinking about placemaking and those social determinants of health, our family health centers are strategically placed in certain neighborhoods based on socioeconomic status and places where care and services might be a little more sparse. We also have 19 school-based health centers within Denver. We also have our Public Health Institute, the Denver Health Paramedics, our Rocky Mountain Poison and Drug Safety Group. And we also have commercial insurance, and again, around 8,000 employees. So hopefully that just gives you a little bit of sense of kind of where we're coming from and what we're doing and kind of how this all fits into who we are in the community. And you can go ahead and hit the next slide. So I mentioned in the beginning that I oversee all of our employee well-being initiatives. And before I kind of launch into our case studies and kind of some of the work that we're doing, I just want to share why it matters and kind of what Denver Health's philosophy is. So thinking back to placemaking, right, in the built environment, you know, we spend like a third of our life or more at work. And so it is so critical that the places where we're spending all of this time and doing all of this work are places that are supportive of our health and well-being. We want Denver Health to be a place where when people come to work, they know and they feel that it's in an environment physically and an environment that has the culture and the programs and the policies in place to support health and well-being and help people reach their highest level of health. It's also interesting to think about, you know, who our employees, who our staff members are, right? So healthcare is obviously an extremely taxing and stressful job. We have some of the highest rates of burnout, compassion fatigue, and therefore turnover. And our whole mission is to care for the Denver community and care for our patients. So we have to prioritize our own health and well-being so that we can take care of others. Put your oxygen mask on first before assisting others, right? So that's kind of our philosophy. And in these next 3 examples, I'll kind of show you how we use strategies related to health in the built environment to do that. So I'm going to talk briefly about each of these. The first one's Belonging Park. I'm going to talk a little bit about some of our multimodal transportation initiatives, and then kind of end with talking about some of the challenges we face as it relates to retrofitting old spaces. All right, so first and foremost, I'm really excited to share a case study with you all about a new space that we call Belonging Park here at Denver Health. So Belonging Park is brand new just as of June in this year. We actually just had a formal opening and ribbon cutting ceremony during our employee appreciation event. And the graphic you're looking at here is something that was used to kind of advertise that ceremony, but you're also getting an aerial view of what the space looks like. On the next slide, I'll share a little bit more about kind of what it is and what's going on with Belonging Park. So Belonging Park was really about creating physical spaces where people, specifically employees, but patients as well, could gather and connect and cultivate meaningful relationships. So we looked at this underutilized little patch of green space and saw it as an opportunity to not only enhance our organization's sense of identity and engagement by bringing people together, but also as a health and well-being initiative. So the establishment of this park really represents a proactive step towards all of that. It kind of aligns with our inclusivity and community building initiatives and really provides a central hub for engagement, different programming opportunities, and different health and well-being activities as well. And so we know that green space and access to it, as well as the programming that it provides opportunities for, can enhance the physical, mental, emotional, and social well-being of people who get to experience it. And the photo you're seeing here is just our ceremony. It was like 100 degrees this day. So just a fun fact. You can go ahead and hit the next slide. All right, so more about Belonging Park, like how did we do this? I mentioned a second ago that Denver Health was, you know, kind of an old campus. We've been there since 1860. Things have changed and the campus has really built up over time. So you're probably wondering, well, why now? What happened? How did this come about? So again, we had this really underutilized green space. And so the first step was folks like myself and my colleagues who worked together in a little work group seeking leadership approval to utilize the green space for a park. We also had this formal ribbon and like opening ceremony so that we could try to activate this space. But we're still actively working on collaborating across the organization, trying to identify different programming opportunities. We're working with our engineering and grounds crew folks to maintain the space. So thinking through things like watering, planting, you know, ensuring that it looks nice and cleaning up trash and all of those maintenance parts and pieces that before we kind of sanctioned this as a park, we hadn't really had to think through as much. We're still working through plans to improve the infrastructure. So again, this was just like a green patch for a while and there wasn't a lot of infrastructure. So we're still looking at things like adding shade and seating to further activate the space. And I think the biggest takeaway here is that for architects and designers, it's really important to think mindfully and intentionally about spaces like this, and focusing on how we could design green spaces and spaces to be activated in this way on the front end versus retrofitting it like we had to do. It's also important to think about the audience, right? So Denver Health, we've got 8,000 healthcare staff. And so as architects and as designers are kind of thinking through what features, what amenities, what factors would go into a space like this, really taking that intentionality and putting yourself in those shoes, and thinking how healthcare personnel, how patients and visitors who come to the hospital would experience all of these things in this green space. And thinking through how that activated space can enhance well-being and enhance the experience of coming to a hospital if you're a patient, which might not be the most enjoyable experience, and how green space and how those things, can really go a long way. So really just thinking about that lived experience of the people who are the intended users when designing spaces like this. And on the next slide, I'm going to talk about something a little bit different. I'm trying to provide you with a few different examples of things that Denver Health does. So switching gears here away from physical space and placemaking, want to just share a little bit about some of the policies and initiatives that Denver Health has for employees and visitors for that matter, when it comes to trying to be a beacon for multimodal transportation downtown. Denver Health really is positioned in a great spot for taking alternative forms of transportation, whether that's bike, bus, or some combination of many things. But again, in my role, I'm overseeing the employee well-being initiative, so I'll talk mostly about how employees benefit from this. But here at Denver Health, all of our benefit eligible employees have access to a free eco pass. So they're able to take all of our TD services like the bus and the light rail for free. We also offer secure and free bike parking throughout our campus. Employees also have access to showers and locker rooms, kind of making biking or multimodal transportation like walking, bus walking a little bit more feasible. And then we also sponsor different bike to work day events and partner with the West Corridor to deliver education to people. So I want you all to know that from an employer perspective and from an employee perspective, if we really want to encourage people to bike or take multimodal transportation to work, we must provide them with the amenities and services to help them make that behavior change just a bit easier. So again, kind of stepping back, and as designers and architects, putting yourself in those shoes. What would it look like, feel like, sound like to bike to work? And what are the things I need, like a climate control secured bike cage or access to showers and things like that. And I know I just have a few minutes left. So lastly, I just want to talk about how we've been creative to kind of make it work, right? We've got an old campus that's been built over time. And so these are just a few creative ways that we've overcome those challenges. So all of our new buildings, which we have several of, have new ergonomic equipment and furniture. Piece by piece, we're trying to retrofit old spaces with furniture and amenities that are health promoting. We're also working on painting areas such as stairwells and corridors with different murals and art projects to further activate the space and kind of promote some of those healthy behaviors, like walking through our tunnels or taking the stairs as opposed to the elevator. And then we're activating the existing green spaces that surround us. So Belonging Park, we're also really close to the Sunken Gardens Park, and we're trying to activate those spaces with programming like yoga in the park and walk with a doc, which you can see photos of here, in an effort to not only provide our employees with opportunities to participate in health promoting activities, but really get people outside, as we know that the access to green space can go a really long way when it comes to burnout, compassion fatigue, and stress and anxiety at work. So I know I kind of flew through these last ones just for the sake of time. We've got some excellent presentations still to come. Thank you to Ynke, who's going to go next. And I'll just leave you with this. Again, Denver Health has overcome so many obstacles, but we've been able to be creative with programming, maximizing the assets, and we're really proud of all of the work we've done in the built environment space to promote employee health and well-being. So thanks so much for your time, and I will pass the baton.
Awesome, thank you. I have 10 minutes, so I will breeze through these, but I just want to say this is really fun. to be part of this conversation. I never thought I would be sharing this work with this field of professionals. And so, and I also want to thank Kristen. I worked with Kristen very closely for the last 6 years through this actual program. And so I get to highlight the great work that she's been a part of. So my name is Ynke. I'm a registered dietitian. I work in public health. Not really a popular place for registered dietitians to work into. You know, often people think, oh, you do meal planning and diets and things like that. I really like to think of myself, I work with the population and how do we improve healthy nutrition environments. So one way we've been doing this for the last 10 years in Colorado is the Colorado Healthy Hospital Compact. And please go to the next slide. I just wanted to kind of set the framework for this presentation, because this is a unique way of sharing this information with you all. Normally I'm working with registered dietitians, food service directors, people that are kind of working in food systems. And so really this presentation will highlight how a set of nutrition criteria really increases the access to healthy foods through an approach we call policy, systems, and environment change. A healthy food environment does influence healthy food behaviors. If the food is healthy and available, people are more likely to choose those healthy items. And then for your profession, really thinking about the design of the cafeteria and how that promotes healthy food behaviors. Next slide, please. So why did Colorado decide to work with hospitals? There's Kristen, everyone, in this photo. This was taken in 2019, which feels like a long time ago. We were doing a Facebook Live event to promote their platinum status, which I'll get into in a moment. But in 2014, Colorado decided to work with hospitals to improve their nutrition environments. And the Colorado Healthy Hospital Compact was birthed out of funding from the CDC back in 2013. And so this is a voluntary agreement that hospitals decide to participate in. And so we've been fortunate to have 3 rounds of funding from CDC. They're 5-year funding opportunities. And so we're in our 3rd funding. You'll see their number, 1305, 1807, and 2312. Not going to go into the nuance of these funding requirements, but that's really sort of like how a state health department is allowed to do this work. Is we get funding from the CDC to do a strategy called food service guidelines in work sites. Next slide. So this is the federal government's way of saying, you know, how do we sort of improve nutrition environments through a set of nutrition criteria? And these guidelines can be used in a variety of different settings. Through federal, state, and local government, hospitals, colleges, and really focusing on those venues within each of those settings. And so looking at the cafeterias, the cafes, the snack bars, the concession stands. And so we really focused in on hospitals because we felt like they were the best venue because they have a robust food system because of the nature of the work that they're doing in hospitals. They have to provide very strict diets for their patients. And also they have the infrastructure to have cafeterias. Some hospitals have a better setup because maybe there's a new build, or like an older hospital like Denver Health, they've really had to sort of retrograde and kind of make changes to their kitchen to really adapt to sort of these nutrition environments. Next slide. So the Healthy Hospital Compact is made up of 4 programs: the Healthier Food Program, the Healthier Beverage Program, Breastfeeding Policy and Support Program, and the Marketing Program. And often people ask, why is breastfeeding part of this initiative? And it's like, what is the best nutrition for a newborn and for the support for mom to be able to breastfeed successfully while in the hospital? And so there's a large component around breastfeeding policy and support. I'm going to really focus in more on the marketing program because I think that's what you want to know most about. But each of these programs has a set of standards, and each standard has certain requirements. So more with the Healthier Food and Beverage Program is where you're going to see those nutrition criteria, really trying to give hospitals the information of like, this is what a healthy meal looks like within this how many calories, how many grams of fat, These are kind of the items for snacks that you want to see in your vending machine. And so there's a lot of data actually that goes behind this in order to make those decisions. And so I wanted to sort of give you some visualizations of like how it looks. Like these are some photos that we've collected over the years through the assessment process. As we collect these assessments from the hospital when they participate, we ask for photos. And so we really want to see like colorful, easy, accessible foods. But as you can see here, like you need to have the salad bar and refrigeration. And so thinking about that, how can you make the space inviting with refrigeration, with placement? And I'll go to that in a few more slides. Next slide. So if you're really wanting to know more about the compact, we have a dashboard, and this was really important for me to sort of share what does a healthy nutrition environment look like. And you can click on the link and you can sort of see, and you can filter out by hospital that participate of, well, you know, what are they at for healthy meals? What are they at for vending machines? What are they at for beverages? We have platinum status is the highest level of achievement, and we have Denver Health being one of them, Lutheran Medical Center. We have a few others. This is a little dated. But and then it's a point system. And so hospitals submit an assessment, and the more standards they complete, the more points they achieve, the higher level recognition. Next slide. So this is kind of what I want to get into when we talk about behavioral design. It's really that idea that if you have place, promotion, pricing, it's the 4 Ps of marketing. And so, you know, utilizing a discount method. I'm not going to go through all of these because you can read these later on, but these are just really some evidence-based examples that when you provide a sample for the daily entree, and people are more likely then to order the daily entree. And if you make that daily, that healthy, that daily entree a healthy item, you're by default trying to get the person to make the healthier choice. Really making all of your grab and goes in a hospital setting, you've got nursing staff, medical staff that maybe have 5 minutes to eat something. So if you make all of your grab and goes the healthiest possible, by default, they're grabbing something healthy and making that front and center, right by the cash register, make that available to them. You know, making the default options not French fries, maybe making it a side salad or a fruit salad. And so there's so many different ways that cafeteria staff can really make the healthier option, the healthier choice. Next slide. So some food for thought as you think about working with a hospital or a clinic that wants to design a cafeteria space, really thinking about the whole process of how food comes into the hospital. So, you know, someone has to order food from vendors locally or across the state or nationally. And so they have to have sort of that back end equipment, you know, freezer space, refrigeration space. They all have to be in compliance with health and safety from the state or their local county. And then what kind of kitchen equipment can they make to really sort of put out healthier items? If they don't have the cooking equipment and they're relying on a lot of flash frozen fried foods, then you're limited to those options. And so really thinking about that good kitchen equipment. I think what's been really fun working with the different hospitals across the state is that access for community members. For example, in Brighton, we have, I'm drawing the name of the hospital, but they participated in Restaurant Week. Because their hospital, a lot of the community members, they're right next door to the local public health department. Community members would come to the kitchen, to the cafeteria, because it was easily accessible. They had good food. They were promoting healthy items, and also it was affordable. Cafeteria prices tend to be lower in hospitals because they really want to be able to provide food to their staff, to their visitors. And so that's really around cost, food affordability. And we see in a lot of rural parts of the state too, that it's a community gathering place. If you go to Salida, if you go to the Heart of the Rockies Regional Medical Center, they provide free coffee and tea for everyone. They spend about $40,000 a year on free coffee and tea for the community, and they get it from a local roaster because this is really important to the CEO of the hospital to build a community. So they'll have people just come in and play bridge games and do all sorts of things in the cafeteria. And so it's trying to really think about how do you sort of bring in the community into hospitals. I think, and so I just shared a couple of highlights from Lutheran Medical Center. They have since moved like last week to a brand new facility, but Kristen Davis is the Nutrition Services Director. And so we can quickly go through these slides, but I wanted to show you how they have sort of their platinum status hospital, next slide, they participate in Sodexo, which is a national food service operation. So does Denver Health. So they utilize a lot of symbols and easy ways to identify something that's healthy. And so anything with a mindful logo is automatically meets the contact criteria. And things, you know, if you have a restriction, like you're vegan or you want to be vegetarian, you have personal preference, really identifying food items throughout the cafeteria space. Next slide.
Hey, Ynke,
Yep.
I'm gonna cut you off in like 1 minute.
So these are just some examples of marketing. This is the banner that all the hospitals receive if they participate in the compact. We really want them to recognize that the statewide program. Next slide. Just again, it's really about information sharing, making it visible, using computers like right in the entrance of the cafeteria of what the entree of the day is. Next slide. I just want to get into some. Next slide. So here, it's all about placement. You know, you think about when you're hungry, you go in the grocery store, really thinking about placing those healthy items that are, you know, right as you're checking out, you know, grabbing something easy like banana, you know, getting chips that are sort of, you know, baked, not fried. Next slide. And just promotions, like really offering as many opportunities for people to try something new. If you, like, for example, quinoa is not kind of, you know, a popular item. And if you are unsure of it, you know, having a taste of it. Next slide. And so, yeah, these are just some slides you can look through just around like product offerings and placement, and you can move on to the end. And that's the end of my presentation. Apologies for being so fast, but reach out if you are very interested in learning more about working with hospitals or other work sites. We're doing a lot to expand our work with other industries, not just hospitals. Thank you.
Thanks so much, Ynke, and thanks to all of our presenters. We do have a couple minutes left for Q&A, so I wanted to cover one question we got in the chat, which was, do all states have a healthy hospital program, or is this unique to Colorado?
This is actually very unique to Colorado. We're one of the few states. There's a few other states that have like programs, but this is pretty unique nationally. And we've gotten a lot of attention nationally on our work. And we're actually publishing a paper that will come out next in 2025 on our data, the data that we've collected over the last 5 years. I did drop in the chat some videos that were just released from CDC highlighting Lutheran Medical Center and Denver Health and participating in this program. So if you're interested in watching, they're only about 3 minutes long.
Great, thank you. Well, we are just about at time, so I think we'll wrap up there. And if there are further questions, we can share the contact info for all of our speakers. Just one closing announcement, if you would flip ahead, Tim. I wanted to share a preview that we're hosting a local symposium for the first time in partnership with Women in Healthcare. So that's going to be our next big event in October. And I just wanted to share a preview of that because we're really excited about this one. It's going to have a number of sessions covering content related to AEC professionals, as well as clinicians and nurses, etc. So it should be a good opportunity to gather together and kind of cross disciplines and learn from each other. So we'll open registration very soon. But in the meantime, you can hold a calendar date for October 15th. And that's all we have for today. So thank you again, everyone, for joining.
Thank you.
Thanks so much.
Thanks to all our speakers. Really appreciate you sharing your time.
Yeah, thanks. All right. See you all.
Thank you.
Thanks, everyone.